What's your name? How old are you? What's your name?
Luke.
How old are you? Name.
Nana.
What's your name?
Nana. I need us.
How old are you?
I need two.
Hey everybody, welcome to the Dr. Mom Show. It's Dr. D, mom of three. So excited that you're joining us again. I hope you enjoyed seeing the baby Tripsies introducing themselves and telling you how old they are. Aren't they super cute? Yep, I'm not partial or anything like that. Well, if you missed our second episode, I talked about having a healthy pregnancy. So if you're pregnant or know anybody who's pregnant, please let them tune in to episode number 2. Also, please don't forget to subscribe to our channel. You can go down under comments or under the description and there's a link there that you can click on, and that will take you to a website to register. And it's getting close because in the next 2 weeks we'll be having a random drawing and there will be one winner who will win a $150 Walmart gift card. Well, again, today we're so excited you're taking time out to be with me, and today we'll be talking about newborn skin and different lesions and rashes that you may see. Overall, I just like to say that babies are weird. The good thing is with babies, most of the weird things they do are considered normal. And whenever you're a first-time parent, it can be tricky, you can get worried, but most of the time as pediatricians or physicians, we end up just reassuring you that things will get better and it's not really anything too big. So the first rash we'll talk about is what's called Erythema Toxicum. This is what we go to med school for. We pay all these student loans to learn these fancy words, but it's also known as newborn rash. So if you're in a newborn nursery and the nurses mention that it's a newborn rash, how this rash looks is that it's usually red at the base and it has a little pustule that almost looks like a pimple on top of that red base. Usually it's distributed on the chest, stomach, on the trunk area, and sometimes the proximal extremities like the arms. It really doesn't get on the palms of the hands or the soles of the feet. These lesions normally occur at about 24 to 48 hours, and they usually resolve on their own at about 7 days of life, and there's no treatment or anything like that. You don't have to worry about putting anything on the baby's skin. Next, we have baby acne, and this is normal. A lot of babies get it. Usually you see little pustules, and it's normally on the cheeks of the face and on the forehead. And this differs from the newborn rash because it's just straight pustules by themselves. It doesn't have that red base like the newborn rash. Again, this normally goes away on its own and doesn't need to be treated. The next type of rash that you can see can occur a little later on in baby's life, and that's at about 3 to 4 months of age. Infantile acne can occur a little later on in babies. This can occur at about 3 to 4 months of age. It's more common in little boys, and that's really because of hormones. This most of the time will go away. If a baby has it very severe, it can go away by a year of age. Sometimes if it's not going away or it's very severe, some babies do require treatment for infantile acne. So the other type of skin lesion is called transient neonatal pustule melanosis. This is most commonly seen in African American babies, and there's different variants that we can see. One type is that there can just be little darker pustules on their skin. Again, this differs from the newborn rash because it doesn't have that red base underneath the pustules. Another variant is if we see what we call hyperpigmented lesions on the skin, and those are just darker spots on the skin. And again, the way this differs is doesn't occur usually. Sometimes it can occur on the face, but normally you can see it on the body too. Next, we have something called milia. Some people even name their children Milia, so does have a nice ring to it, but it is a skin lesion. These are white papules that occur on the skin, and normally you see them on the nose of babies. So if you see little white bumps on a baby's nose, that's what it is. Or sometimes it occur on the cheeks. This will resolve on its own. There's no treatment for it. And it doesn't mean anything's wrong with your baby's nose or anything like that, because it will go away. Kind of a sister lesion to that is something called Epstein pearls. They look the same way, where they're little white deposits or little white pimple looking areas, but they're located in the roof. So if you look at the top of the mouth and the roof of the mouth, so for example, when the doctor is looking in your baby's mouth, you can always say, hey, can I see in there? And a lot of times we'll see 2 or 3 of those little white spots on the roof of the mouth. Again, it doesn't mean anything. It won't turn into anything. They're benign and they'll go away on their own. They don't need any treatment. Next, we have a lesion called a Mongolian spot. Mongolian spots normally occur in Asians, Hispanics, African Americans. These spots have a bluish grayish hue to them. Some of them can even have a greenish hue, just depending on the complexion of the baby. The most common place it occurs is on the back. Sometimes it can even be on the shoulders. Normally, these do go away at about 1 to 2 years of age. They'll fade away. Now, one thing about these spots is that if they don't go away and your child still has them after they get older, is when they start school. Some of them can look like bruises. So I would probably tell the teacher or their babysitter, hey, you know, my child has this mark that they were born with. Just, you know, nobody thinks you're beating your child or anything like that. We don't want something like that. So just so they're made aware that the child has that skin lesion on them. Sometimes some newborns will have skin that peels. We see this a lot, especially in babies who are born term or if they're born post-date. So if you had a baby who doesn't want to come out and then either you're getting induced or you're having a C-section, you can see that. And one of the main reasons is just because the babies have been sitting in water. You know how we get all wrinkly? Well, these babies have been sitting in water for months. So a lot of times we do see that. If your child's or baby's skin is peeling, you definitely at least should have the pediatrician take a look at them, because there are some disorders that we do see baby skin peel. So don't always think that it is because of them being in the womb for so long. Sometimes something can be going on, but again, this is why it's important to keep all the babies' checkups with their doctors so they can check them out and do a thorough exam. One thing with baby skin is that it's very sensitive, so be careful. Don't switch creams, lotions, or detergents all the time. Try to stick with one item as far as detergents or creams. Also be careful with the perfumes or the colognes that parents, you all are using, because the babies, you're doing a lot of skin to skin. Who's not loving their baby? So you want to be careful with that. Normally we suggest using creams or lotions that are unscented, because when creams are fragrance, usually if they do have sensitive skin, it can cause their skin to break out some more. So today's fact that no one told me would be, no one told me that babies get what's called the APGAR score when they're born. After birth, when we take babies to the table, we do what's called the APGAR score, and pretty much what APGAR means, A is for appearance, so we look at the baby, check out the color. We don't want the baby to be too blue. P is for pulse, and that's just checking the baby's heart rate. G is for grimace, and that's just making sure that the baby's, you know, when they're stimulating, that we're getting a response. A is for activity, of course, that the baby's moving around and not limp. And then R is for respirations, of course, making sure the baby breathes. The highest score the baby can get is a 10. Normally we do this score at 1 minute of life and then again at 5 minutes of life. If a baby is having a harder time and their scores aren't high, because the higher the score is what we want the baby to have, we repeat that score again at 10 minutes of life. Well, thank you again for joining us. We hope that this video was helpful as we talked about babies' newborn skin. Again, if you have any comments about any shows that you want me to talk about, any topics that you have in mind, let us know. Also, don't forget to subscribe to the Dr. Mom Show. Just click on the link so maybe you'll be that lucky winner. Thanks again. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Bye-bye.